dealing with multiple sclerosis. Next, On Call with the Prairie Doc.
Good evening and welcome to On Call with the Prairie Doc. Multiple sclerosis, or MS, is an unpredictable, often disabling disease of the central nervous system that disrupts the flow of information within the brain and between the brain and body. When a person is diagnosed with MS, it can affect not only their body, but their attitude. How people feel about themselves and their path through life can be dramatically changed. Tonight, we tackle life with MS. And now for this week's Prairie Doc quiz question. Even though MS involves the body's own immune system, it may attack parts of the brain, spinal cord, nerves of the eye, all of the above. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of my book, A Picture of Health. I wrote this book with the wonderful accompanying photographs by Dr. Judith Peterson. As a special bonus tonight, we'll be giving away a book by our guest, Dr. Jerry Freeman. We'll announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer in. Joining us tonight is Dr. Jerome Freeman, a neurologist at USD-Sanford School of Medicine and Sanford Neurology Clinic, and Joe Landis, a registered nurse at the Sanford Neurology Clinic working with Dr. Freeman. So, Joe, tell us a little bit about you, where you're from.
Well, I grew up at Flandreau and went to high school there, and then when I finished school, I moved to Sioux Falls, went to LPN school, and started working at Sanford, or at Sioux Valley at that time.
Yeah.
And then joined the neurology clinic, and Dr. Freeman, he always tells the story that he wasn't even there when I started there. So he tells everyone that I was there first. So, and after I was at the clinic for a few years, I went back to school, became an RN, and then after I was an RN, I just had this special draw to MS, and I'm not really sure where it came from because I don't have any relatives that have it. Like a lot of people, their mother or somebody has it, and I don't have any relatives with it. But they're a special kind of person, and I just decided I had a special interest in that, so I went on and took a certification for MS so we could be more involved with the MS community. And
you're the right-hand person for Jerry on all sorts of neurology things. So you're his nurse, works hand in hand with him.
We've been together a lot of years.
Partner in crime, as they say. Jerry, tell us a little bit about yourself. You're from where originally?
Well, I grew up in Sioux Falls for the most part. I was born in Minneapolis and went to medical school in Utah, University of Utah, and then did residencies in Kansas City, did internal medicine and then neurology.
So you're an internist, like I am, and a neurologist, whereas a lot of neurologists are just neurologists.
Yeah, that's correct.
So you started the correct way, and then you had to, deviated off the path. But anyway, you did your neurology there in Kansas City?
In Kansas City, yeah. And I've always done general neurology, but like Joe, I became increasingly interested and focused on MS. It's very common. There have been increasingly good treatments for it, and we've just found it really enjoyable to work with people with it.
It's nice to have something you can do for people. In neurology, there's a lot of times where a person is saddled with a disease that there's not much good treatment.
That used to be the case, especially, say, 30 or 40 years ago. Now, so much of what used to be untreatable is treatable. Parkinson's disease, strokes are a good example, and MS is a very good example of something that 30 or 40 years ago, the treatments were fairly futile. Now, they can be very good and effective.
Our whole story here is that we depend upon your questions, and we'd like to take your neurology questions, particularly your MS questions, so don't hesitate to give us a call, 1-888-376-6225, or go to the internet site On Call with the Prairie Doc or prairiedoc.org and leave us a question. So let's talk a little bit about the issue of MS. I mean, we didn't even know MS was something until when? 1800s?
Yeah, I suppose 100 years ago. People clinically began to make the diagnosis. But there were very ineffective ways to try to prove MS until MRIs became available. The MRI scans, magnetic resonance imaging, are very specific, and they can show MS lesions in the brain and in the spinal cord.
So the question is, and I've heard this from my beginning of training, the first month that I was a resident, or an intern actually, was on a neurology floor, and that is that MS, you can recognize it, this was before we had MRI, because it occurred over time, different episodes, and in different places of the brain and spinal cord. Could you explain that better?
Well, it used to be thought that you couldn't make the diagnosis until a person had had more than one attack and had attacks in different part of their body, or so maybe the brain and the spinal cord, or different parts of the brain. But again, these thoughts, this definition, was before you could actually peer into the brain and the spinal cord and see the lesions that were causing the problem.
And so you can see lesions oftentimes before they have symptoms.
Yeah, oftentimes you can, yeah.
So let's talk about those symptoms. I mean, what are the classic symptoms? We've got some pictures to help us, guide us in that question. What are the common symptoms of MS? I mean,
Joe, you might get that first, because somebody might call.
Right, people call in, or physicians refer a patient, and they a lot of times have trouble with numbness and tingling and weakness in an extremity, and it can be one side or sometimes both, uppers, lowers. They can have visual changes where they have blurring vision or even loss of vision. And it's frightening for people, because we had, people, sometimes they have symptoms for days or weeks and they ignore it, and sometimes they wake up in the morning and they've got a weakness in their leg and they're on the phone right away wanting something done. And so one of our goals in our clinic between Dr. Freeman and myself is to get these people in and be seen to alleviate their fears, because maybe it's MS and maybe it's something else, and until they know, people are like, crazy about it. They don't even, know how to take over. And
yeah, the fear is a big thing.
Fear is big.
So, I mean, the ophthalmoplegia, or the weird ophthalmologic, or the eye muscle problems, that's probably the most common symptom?
Well, probably the most common eye thing is just loss of vision, optic neuritis, and inflammation of the eye nerve. But what Rick was talking about is you can also get double vision or distorted vision. Sometimes you can get real jerky eye movements called nystagmus. So the eyes frequently are affected with MS.
Would you say that's the most common symptom?
I would say optic neuritis is probably the single most common. At some point in a person's course of MS, many have optic neuritis.
All right. So if I thought that I had something that could be MS, your first diagnostic test would be an MRI and a lumbar puncture?
No.
History. What were you going to say?
I was going to say history and exam, because you have to get a good history.
So there it is, and we have had that tool for many, many years, haven't we? So that's an important thing. We'll go to this now. Some would say that the most effective way to deal with MS is through a focus on your lifestyle and how it affects your disease.
The first symptom I had was probably 1969. I woke up one morning and my right eye, I could see the top half of it was normal, the bottom half was black. And I knew something was goofy. So I went to an eye specialist in Duluth, Minnesota, and he told me when I got back home to go to an eye specialist in Sioux Falls. And I was lucky. For the next 34 years, I really didn't have any symptoms. And in that 2003, I was officially diagnosed as having MS. I went to a walker. Then from the walker, I went to a scooter, and I use a scooter now and this chair to maneuver and get around. Other than that, I still can drive the car. I'm out and help my son in the spring and fall, putting crops in. I do pretty much what I've always done. I go to the ball games. It really hasn't changed the whole, it changed me, but I can still do a lot of things, so I'm lucky. When I look back, yeah, I had some symptoms, especially towards the later years before my diagnosis, but they were nothing serious. I mean, they'd come and go and you'd think nothing of it. It just thought that's just sort of a normal thing that happens. And it finally got to the point where the heat got to me, and my walking, it just wiped me out. So I knew something had to be checked out. So I went to a neurologist, and after a few tests, they decided it was MS. And I use some weights on my own for therapy. I got bands I use. I do stretching at home. It's those types of exercises you do. Anything that's movement helps. If you take care of your health, that's a diet, some movement, good attitude, that will make you feel good. You're not going to cure MS, but make you feel good otherwise, so it just goes a long ways.
Well, he was a great example for us, wasn't he? He talked about lifestyles. Mm-hmm. I thought that was really good. Attitude is important. Joel, what did you take from that?
Well, one thing that we always stress to patients is that our goal is to keep them doing exactly what they're doing now, whether they're, have a business or, want to raise a family or continue on with their education or where they are in their lifestyle or lifetime. But we want them to be able to, our goal is that they can do all these things, because I think when people hear that they have MS, the first thing they think of is they're going to be disabled. And with the treatments we have now, we've been able to kind of curtail that for a lot of people. I mean, we're on top of that more than we used to be.
Yeah. Do you see many people in wheelchairs or from that, Jerry?
We see some, but they frequently are older people who have had MS for a long time. It is, I would say, rare for a young or middle-aged person with new MS to suddenly progress to needing a wheelchair. Even people with fairly severe MS, most of the time, are still able to get around and function pretty well.
So what's the toughest part of it? Is it, does it get their attitude down? I mean, or the fear of it, or the mood?
Attitude, that was mentioned in that clip, but if a person has a positive, hopeful attitude, with any illness, it can be a huge benefit. Some people have the ability to see a positive perspective, and some don't. I think you'd agree.
Right, and the main thing is we just try and remind people that if this is a flare, we're going to do what we can to get you back out of it and get on with your life. And I tell people all the time, you probably sat with 5 people in the waiting room who have MS.
Didn't know it.
And you can't tell it, because, that's our goal.
That's it. We do need your questions. I mean, this is your show, so give us a call at 1-888-376-6225 or ask at oncalltv.org. So give us your calls and your questions about this. And we do have one. A 90-year-old woman is wondering if there is a similarity between MS and hydrocephalus. What's hydrocephalus?
Well, hydrocephalus is an expansion of the cavities in the brain. The ventricles, they're called, can get big and under pressure. And usually hydrocephalus occurs in children. Occasionally a more elderly person can get hydrocephalus, but the symptoms usually would be different than MS.
Mostly what? Gait, incontinence, and emotional
There's something
ability.
called normal pressure hydrocephalus.
They have memory trouble sometimes with it too.
Yeah. So let's talk about, when you're a child and one of the lakes exit out of the lake, the drainage, the place where the water drains out of Lake Ponset, it's plugged and the lake expands.
That can be catastrophic. That can be associated with a bad headache, real tiredness, lethargy, seizures. If a child has hydrocephalus, there needs to be emergency surgery usually.
Right, and you drain it. You put a tube in there and you drain it. But there is this condition called normal pressure hydrocephalus. Explain that.
That's something that elderly people get, and it is associated with the triad that Joe was alluding to: memory problems, bladder problems, and walking problems. And usually the ventricles do get a little bigger, these cavities in the brain. And if somebody has that, they can be benefited by a shunt. It's called a tube that actually goes from the middle of the brain down into the abdomen and drains the fluid. This is a pretty rare condition. There are a lot of people who have trouble walking and trouble with memory who don't have this normal pressure hydrocephalus, but it is potentially treatable.
You know, in all my years of practice, I had one, I think, when I was on the faculty at Emory. And I have had, you know, maybe 6 or 10 people that I thought might have had it. Some had shunts, some didn't. Nobody got any better, and I was disgusted with it until this year. A patient was having the classic symptoms. Incontinence was primarily happening, and she was losing her ability before us. And one of my partners made the suggestions this could be NPH, normal pressure hydrocephalus. Indeed, it was, and we got a neurosurgeon who was reluctant because, you know, this is a rare deal. Put in the shunt, continence went away, gait returned, mental status improved, and she sings in my choir now. So she's, you know, it's an amazing thing when it works.
And yeah, so we've had
We've
people
had
in our
people.
practice too. It's just
Life-changing.
spectacular.
Yeah, hallelujah. So that was the pressure, normal pressure hydrocephalus question. We have another one. Discuss the probable causes for inclusion body myositis. Could it possibly be caused by trauma from many surgeries? Now, I'm not aware. I have no idea what inclusion body myositis is.
Well, it's a rare condition that would be part of what's a muscle problem, myopathy. And that's different than MS. MS involves the brain or the spinal cord, as opposed to the muscles. If something is affecting the muscles per se, it's frequently a myositis, which is an inflammation, or a myopathy, which is a muscle disease.
So differentiate that from Lou Gehrig's disease.
Lou Gehrig's disease is a spinal cord problem, and the muscles lose their size, basically. They become atrophied, and a lot of times they can develop rippling movements called fasciculations. And Lou Gehrig's disease is generally a progressive condition, and that, unfortunately, there is not treatment for.
We don't know why it occurs.
We don't know why it occurs. It's called Lou Gehrig's disease because the famous baseball player Lou Gehrig, while he was still competing, still a player, developed it, and he made his famous goodbye speech in Yankee Stadium. And he had a good attitude. He said, I have been a lucky guy.
Yeah, but he didn't live very long
No,
after that.
no, it's a very serious disease.
Yeah. But that's primarily profound weakness, and they lose their speech ability.
You can get marked slurring of speech. You can have trouble talking. But typically, people with ALS develop marked wasting of muscles, marked atrophy.
Amyotrophic lateral sclerosis,
Yes.
Lou Gehrig's disease.
Same thing.
Stephen Hawking.
Stephen Hawking, the famous physicist, has a form of ALS, but extraordinarily rare. I mean, he's developed, it's such a severe condition that he needs to be on a breathing machine, and yet he has survived decades. Most people with ALS don't survive more than several years.
And it isn't just because he's got all the support in the
No,
world.
he has a variant that has permitted him to survive long term.
He's still quite disabled. But
Very disabled, but-
that's the characteristic of this whole ALS story. The brain is intact. They see it happening to them.
Right.
They don't get demented with it, and that's maybe one of the sad parts of it, too.
Right.
But what's challenging for all of us is to differentiate symptoms that can kind of seem similar and decide, is it a myositis, or is it the spinal cord, or is it the brain? And
That's why you got an
Well, that's
intact
what-
job. You've got a job. We need to keep you.
that's what we try to do.
Wait,
Try to figure it out.
Yeah, 68-year-old man from Sioux Falls asks is MS an autoimmune disease? So what is MS? Is it autoimmune?
Yeah, it is autoimmune. It's an inflammation that develops in the body and attacks normal body structures. It attacks the covering of nerves, and the nerves in the brain or the spinal cord. The covering is called myelin, and MS causes a fraying or irritation of this covering. I really do think it's like an insulated wire. If you picture an insulated wire with spots where the covering would be worn
Chewed
through.
off by the dog.
Chewed off,
Which is
yeah.
what happens at my house.
And if it's chewed off in certain places, then you develop the symptoms. You develop the double vision or numbness or trouble walking.
It reminds me, it brings up the topic of one of my favorite words. You know, you catch these things in med school and you hang on to it. Then there is a cell that makes that called the oligodendroglial. And so I had a chance to say it. I'm sorry, I couldn't help myself. We have a 30-year-old man from Brookings who asks, I have heard that getting a fever from exacerbating the symptoms of MS will exacerbate the symptoms of MS. A fever might make it worse. Is it true? Are there other factors that can worsen symptoms of MS? Joe, have you?
I mean, when people have another illness, like if they have an upper respiratory infection and you have a fever or even just your cold symptoms, it can worsen. People call in and they feel like they're having a
MS attack.
MS attack, and we kind of refer to it as a pseudo attack because it's probably related to the fever. I mean, tell them about how they would used to diagnose MS with.
Well, it's been
hot
known for
baths.
years that people in warm situations might have worsening of their MS. And before there were good tests for MS, there was something called the hot bathtub test. Literally, they would put people into a very hot bathtub and then see if they developed more symptoms like jerky eye movements or weakness on one side. We would never do that today because you worry about bringing these symptoms on and then them not going away.
Mm-hmm.
But certainly getting overheated in general can cause a flare of MS symptoms. I think we both remember a fellow who had fairly well controlled MS, but if he went out in the middle of the day and mowed his lawn, he'd get really weak and rubbery in the legs. This was an example of the effect of the adverse effect of heat.
And then they come back in, get in the air conditioning, and sometimes their symptoms are alleviated pretty quickly if they get cooled off.
So that brings up the question about MS in the northern climes. I mean, we find that MS is a northern world disease, not in other words, in the colder climes. Counter to the point that you're making that heat makes it worse. We have a map. So explain that, Jerry.
Well, the blue areas and red too are areas where there's a higher incidence of MS. So in our country, the incidence of MS is lower in Florida and Texas than it is in Minnesota and South Dakota.
And you know that because, I mean,
That's the incidence
Right.
of MS.
We know that.
But yeah, it's been known for years.
But why?
There have been postulations as to why. One of the most interesting theories now revolves around vitamin D. It's known that in warmer climates with lots of sun, your vitamin D levels can be higher. In South Dakota, North Dakota, and Minnesota, frequently vitamin D levels are low. This is a theory, but I think with some plausibility that vitamin D may be a factor in MS.
Well, I'm one who measures a fair amount of people's vitamin D level, and when it's anywhere near low, they're on 2,000 international units a day or more to get them up into the right level. Do you?
And when Joe and I feel the same way, I asked you earlier, how many people, percentage-wise, we check vitamin D, is it low? What did you guess?
I mean, most of people are low, especially, and they're lower in the winter than they are in the summer. And a lot of people in the summer say, oh, I'm outside all the time, or I drink a lot of milk. And I read an article one time that said you have to drink 20 glasses of milk a day
to get enough vitamin D.
Fortified vitamin D milk to get enough vitamin D. Well, no one probably drinks 20 glasses.
And to supplement, and this is to your point, Rick, to supplement vitamin D, to take 1,000 or 2,000 IUs of vitamin D, it's simple, safe, and
cheap.
Potentially beneficial.
Yeah,
cheap,
why would you not do it? Particularly when you're north of Omaha. They say that that's the line where you just cannot get enough vitamin D. You can't get enough sun.
Yeah.
You know, even if you stay out in the
Yeah.
in the sun. We've got tons of questions. A woman from Corsica states that she had 2 sisters with MS. Both have since died. Is there a hereditary link?
There is a hereditary link. Most people with MS don't have other family members who have it, but it clearly exists in some families. Siblings can have it. A mother and daughter might have it. In fact, in our practice, we have a number of instances of 2 generations of
Right.
people. One thing is you cannot predict, say if a mother has quite a bit of trouble with her MS, that her daughter will have the same amount of trouble. It's a different presentation in different generations.
Well, and maybe early treatment.
Early treatment makes a
Prevents
huge,
it from-
huge, yes.
You know, there's a lot said about treatment not being effective. And what do you think?
Well, I think we would both strongly disagree with that. I mean, in fact, we not only believe in treating, but our goal is to keep people, number 1, from having new symptoms, and number 2, from developing new lesions on the MRI. I mean, if we have somebody with MS who feels okay, but she or he is developing new active lesions on their MRI, we are not satisfied. We believe you have to curtail that.
So treatment, of course, the old treatment was steroids, and then new treatments is what?
Well, steroids are still good for a flare, for an attack. We use very, very high doses of steroids for several days or a week. The old standard treatments are called the platform therapies, are shots, like a diabetic shot. And there are 2 main categories: interferon drugs, they're called, and glatiramer acetate. And these have been around for 25 years. They're fairly safe. We know the side effects of them well, and many people on these treatments do very well.
The brand name?
Brand names would be like Copaxone or Rebif or Betaseron.
Okay.
Just several brands. In the last 4 years, there have been a new tier of oral medications out that people are very excited about. Obviously, it's nice if you don't have to do a shot. And there are some advantages of the oral, but also some potentially bad side effects. And so we have to, I think, weigh carefully, should we stay with the injectable treatment or should we go to one of the orals? It's not an easy decision. It's one that I think the person with MS and you and I want to talk about it quite a bit,
Right.
and weigh the pros and cons.
Okay. We have a question about neuropathy in hands and feet. Is that connected with MS? Neuropathy meaning numbness in hands and feet. You see it in diabetes mostly. Is it related?
No, because neuropathy is not in the brain or spinal cord, it's in the outer nerves themselves, so the nerves of the arms or the nerves of the legs. Probably the most common cause of neuropathy is diabetes. A really common cause of numbness in the hands is carpal tunnel syndrome. I'm sure some of the listeners have had that. Commonly, if you're doing something repetitively like keyboarding with your hands, you might get numbness and have to shake them. Often people awaken in the morning or during the night with numbness. That's due to a pressure on a nerve, and that's pretty treatable.
Well, we discussed that last time, and if you're interested in knowing more about that, because we went on and on about it last week, go on the internet site and watch prairiedoc.org and check it out. Important research in MS is taking place right here in South Dakota. At South Dakota State University, there's an active study about the effects of exercise and cognitive behavior therapy on well-being of MS patients.
With exercise, we look at the physical body, right? With cognitive behavioral therapy, we're looking more at the mental side of things, because with multiple sclerosis, oftentimes there's increased levels of anxiety, depression, even suicidality, especially early in, shortly after being diagnosed. They're trying to come to terms with being diagnosed with multiple sclerosis. There's no cure for the disease. To many people, it's really hard, it's difficult, it's something that they're gonna have to deal with for the rest of their lives. And so when we focus just on the physical aspect and we forget about the mental aspect, we're really doing a disservice to them, because we want to help the whole person. And so that's what we're trying to see. Does combining the two result in better outcomes? Because they did find that cognitive behavioral therapy will improve quality of life, will reduce anxiety, it will reduce thoughts of suicide and those types of things. But my thought is, well, if we combine those, is there an additive effect? And that's really what we're trying to determine, is there an additive effect of those two training types? Before we started implementing interventions, the first thing we had to do is, let's compare people with multiple sclerosis to a healthy non-multiple sclerosis population. And so one of the things that we found when we did just simple sit to stand is that it takes people with multiple sclerosis that have leg weakness longer to stand than your typical person, and they exhibit a different strategy. What we found is the biggest limiting factor was their leg strength. And so with that understanding that, with their leg strength, let's see if we can improve their leg strength through the exercises. I went to a conference and I was presenting some research, and the feedback that I got is, we need to know what the stability is while they're doing something when they can't use both of their hands, like brushing their hair, or brushing their teeth, washing their hands. And so what we did is we created a sink that we put right by our force platforms, and so they put both feet on the force platform, and we can measure how much they're shifting, where their center of mass is, and we have them with Play-Doh basically mimic washing their hands so we can get their stability. For some of the studies that we're doing, and the study certainly we're doing right now, we don't have all the data back yet. Some of them are still in the intervention process, and some of them are, and we're collecting the pre-data now. But just one story, there was a woman that we've had in here, and her goal was to be able to go on a hike and be with her grandchildren, and so that she could keep up with them. And just this last summer, she was able to hike Harney Peak, whereas before, had she not participated, from her own thoughts, she wouldn't have been able to keep up and may not have even been able to get to the top. But because of this intervention, she was able to do something that she really wanted to do. And really that's really what drives our research in this lab, is how can we improve function? How can we improve quality of life?
So, Joe, tell me what you said about this.
Well, we
gentleman.
were contacted by the organization, and they sent us some flyers, and we've been giving them out to patients. And I know of a few patients who are enrolled and who are excited about it, to get an evaluation and see what we can come up with.
Right. There's also this big therapy, right, where they teach, or that's Parkinson's disease. That's Parkinson's, isn't it? That's another story. We'll go somewhere else. 46-year-old woman asks about MS and related stem cell research. Jerry?
Well, with MS and a lot of other conditions as well, there is a huge interest in stem cells. There are some programs around the country and around the world that are using stem cells. I think they only should be used I would say, at a major university where there's a controlled study. So you know about the safety and you can find out about the risks of it. But my hope and guess is the stem cells will be increasingly part of our armamentarium in terms of what to use for MS.
So what you just said triggered a little concern in my mind. I know that when people are desperate and the therapies are sometimes not as good as we'd like them to be, there are people out there, sometimes in foreign countries, sometimes in the US, who are promising more than they can deliver for cash up front and are doing weird things that are not proven. Any comment?
Well, there's a lot of that in our society, and it's not just with stem cells, but with testimonials of various types of interventions, some very expensive, and people hear about these possibilities and are oftentimes feel so desperate they want to jump in and try it.
And your comment?
Well, I would caution people to look at what they propose to do and make sure it's safe and make sure there's evidence that it's effective. In MS, for a number of years, there was huge enthusiasm about dilating veins going to the brain. This Italian neurologist contended that if you went into the vein and dilated the veins.
The veins.
The veins, not the arteries.
Yeah.
And it seemed like a strange and unlikely premise, and yet there was huge interest in this, and it was done in various parts of the world and in this country. It's never been shown to be safe, and it's never been shown to be effective, and there have been some bad complications from it. It's not talked about as much anymore, but I would say, 5 or 10 years ago,
Yeah,
it was
probably
huge.
10 years ago. It was very common.
I think the idea of when they promise the sun, the moon, you better go to your local doctor that you respect and talk to her or him about it. That's another question. Why is the medication, the Copaxone that the grandson is on, is so expensive, and is there any other alternatives? Speaking of expense and loss of, why are our medicines so expensive? Very quick answers.
I feel like a long answer for this. I think
Okay.
it's unconscionable. I mean, the drugs that 10 years ago, same drug cost $20,000 a year, now costs $60,000, and that isn't research and development. I think that is
Highway robbery.
Well, it's just, I think it's charging people who are vulnerable and have bad conditions, and I think it's gotten out of hand. It's too expensive.
I mean, out of the, 5 or 6 platform drugs that are used, they all cost the same amount. I mean,
Exactly the same.
They're all
Virtually.
about $50,000 or between probably 50 and 60.
Now, insurance companies are very good in covering that. Medicare covers these drugs for the most part, but there still is a huge issue of why are these so expensive?
Yeah, don't you think over time, they should be less? How about, so you feel the same way that the lady feels about
I do.
her grandson.
Yeah.
63-year-old man, why is exercise talked about so much for MS patients when it may cause people to struggle and get dizzy when they do so? Joe?
Well, we always tell people that exercise is good, whatever stage you are in your MS.
It's not going to make it worse.
It's not going to make it worse as long as they don't fatigue themselves and get their body overheated and that kind of thing. But just, if you're in a wheelchair and all you can do is this every day, that's good. At least you are doing some movement. And our therapists out there are excellent in guiding people as to what their limitations are. Maybe it's swimming, in a cool pool.
But it is counterproductive for a person with MS to push him or herself
Past the
to
point.
exhaustion. That has a deleterious effect.
77-year-old woman from Sturgis. How have you heard of fat pad atrophy, and could that be systemic? So that's maybe neurologic, maybe not. And so your answer, fat pad atrophy?
That would be more of a muscular or peripheral nerve thing.
Right, and I don't have a good answer either. I have not. 48-year-old woman from Sioux Falls asks, I was diagnosed with MS over 20 years ago, currently have relapsing remitting MS. What are the chances that my MS will become more progressive, or will I likely stay in this relapsing remitting stage?
That is an excellent question, and it's one that we ponder all the time. Our hope is that about 85% of people start out with relapsing remitting. And the hope is that if a person is aggressively treated over decades, that she or he will not go into a more progressive phase.
There is a chance, there is a progressive, constant getting worse phase.
Yes, yes.
That occurs about?
Maybe 10% of the time. That's called primary progressive. But in answer to this question, some people with relapsing remitting eventually become more progressive. But one of the goals of treatment is to stop that, to prevent going to progressive.
Do they still have relapses, but that it doesn't deteriorate?
Yeah, that's the hope. Or of course, the hope is to stop the relapses too.
Right. How often do these relapses occur, as a rule? No rhyme, no reason.
No rhyme or reason. I mean, sometimes, maybe once or twice a year we might hear from somebody, and then we've got people who haven't had a relapse for 5 years or longer. You know?
And as they get older, does it burn out?
I think it does. I think it does. In fact, it's not uncommon for us to discuss about maybe stopping MS treatment at, say, age 70. If somebody's been stable for a long period of time, their MRIs are stable, we might stop treatment at that point.
Okay. I had a question about neuropathy spreading or leading to MS.
No, neuropathy, again, is peripheral nerve. It's in the arms and legs, but not in the brain or spinal cord. And that should have no relationship to MS.
We have a 69-year-old woman from Pierre about myasthenia gravis in the same family or ever mistaken for MS. Is it like MS? Myasthenia gravis, what is it?
That's a very good question, because myasthenia gravis is a muscular problem, but some of the symptoms could mimic MS. With myasthenia gravis, you could have double vision, you could have trouble talking or trouble swallowing, and you can have weakness. So the symptoms can look similar to MS.
But it's muscle, not
It's muscle
nerve.
as opposed to in the brain or spinal cord. But that's why getting the history right, the story right, and the examination right is so important. Because a lot of things can cause weakness. You
All
have
right.
to figure out what it is.
But this is also an immune system disease.
Yes, it is also
And
an immune system.
we think that MS is an immune system. I read in 1935, a guy injected myelin, finally was able to take that covering of the nerve and inject it and cause MS-like disease in mice. And
Yeah.
that's been the consistent thinking that it's the same kind of disease.
Yeah.
61-year-old from Washington Springs has had MS since '82, is confined to a scooter, good upper body strength but can't walk, heard a cure for MS in London with chemotherapy to kill blood cells and then take stem cells and re-inject them into the system after chemo. Have you heard about that?
Have heard about it. If somebody has had persistent symptoms for a long period of time, it's unlikely that any of the things we know of now are going to reverse that. But the stem cells and aggressive chemotherapy are something that can be used. We infrequently, but actually recently, we've had a couple people with very aggressive MS who we have on strong chemotherapy drugs, and it does stop the flare. So drugs like Cytoxan,
Methotrexate?
you could use methotrexate or mycophenolate. These are powerful drugs, and you can't use them
Willy-nilly.
willy-nilly. It has to be for a compelling reason.
87-year-old woman from Monaca says her sister died from MS at 78, was diagnosed early in her 50s. She was completely helpless at death, but her mind was still sharp. Are there better treatments now so people don't suffer as she did?
Yes, there are. I think the short answer to that is there are way better treatments in the last 25 years than we ever had before. When MS, though, begins at an older age, say 50 or 55 or 60, then it may be more of a progressive type instead of relapsing, come and go MS.
What's the difference between MS and muscular dystrophy?
Well, muscular dystrophy is a chronic, often genetic type of muscular and extremity problems. Usually that is a steadily progressive type of an issue. Oftentimes muscular dystrophy begins in childhood or adolescence, depending. There are multiple types of muscular dystrophy, but it's, again, more of a muscular problem than in the brain or spinal cord.
An 84-year-old woman from Rapid called about her granddaughter who has MS, is deaf, has no facial expression, told that eventually will be in a wheelchair. Why does MS cause loss of body control like that?
Well, that's an unusual presentation, but any part of the brain or spinal cord can be involved, and so rarely one could have hearing impairment, but
Not
That's
common.
not a
that's
common deal.
extremely uncommon.
Something, it might be something else. I had a question of someone who had seizures this last time she had an MS.
That's also possible, but very uncommon. And if I was following someone with MS who had a seizure, I would look hard for something else
Another
causing
cause.
it.
Do tremors turn into Parkinson's disease? That's a good question.
That's a good question. And there are two types of tremors, basically, two main types. One is a tremor when you're just sitting. It's called a resting tremor.
Like a pill rolling
Pill
tremor.
rolling tremor. That could be a Parkinson's tremor. Many people have what's called an intention tremor. They have tremor when their hands are out, or they have tremor when they go to reach for something.
Or soup.
Or
They
soup.
can't eat
Soup. That does not lead to Parkinson's. That's a different type of tremor.
Totally benign. 29-year-old Rapid City, could you explain, somebody's messing with my question here, a brain-gut connection with MS?
Well, people with them, and I'll start with this, and you may want to amplify it, Joe, but the bowel and the bladder can be affected with MS, and you can have decreased bowel motility. You can get bad constipation would be more common than diarrhea. Certainly there are bladder issues. We were talking recently about some of the treatments for bladder issues.
Yeah, I was just talking to Dr. Kevin Benson, who treats bladder incontinence with Botox, which is becoming more popular and is very effective for MS patients.
All right.
Can be very effective.
There is a question about someone who can't do an MRI because they have a pacemaker. How do you make the diagnosis?
Very hard. I mean, because we rely on our technologies, and most of the old MRI pacemakers were not compatible with the MRI machine. In the last couple of years, they've developed and are putting in pacemakers that do permit the MRI. But it's harder if you can't see and prove the diagnosis. Then you'd really rely on the history and the exam.
There you go. And now for the winner of tonight's Prairie Doc quiz question. Even though MS involves the body's own immune system, it may attack A, parts of the brain, B, spinal cord, C, nerves of the eye, D, all of the above. The answer is D. Agree? Agree. So the winner was Marilyn Decker from Huron, who answered the questions correctly. Thank you, Marilyn, for participating. And 2 books, including Jerry's book on short stories, will be in the mail for you. We'll be right back after this.
Here you are. You're at a point in your life where you have plenty to say. Don't let hearing loss stop you. An amplified or cap-till phone can help you stay connected so you can understand every conversation and not miss a thing. Call or visit us online to learn more.
Multiple sclerosis remains a mysterious disease. This is because MS happens for no obvious reason, affects more often young, healthy women, but also people of all ages and both sexes, causes vision problems, numbness, balance trouble, weakness, and paralysis, but also can affect the nervous system anywhere in the eyes, brain, and spinal cord, and can come and then go away, or can reoccur, progress, become unrelenting, and severely disabling. This lack of a consistent pattern makes it no surprise that MS has been viewed with mystery and superstition throughout time. And the variable nature of the disease makes it ripe for snake oil salesmen selling false hope and phony cures. In her book, Legwork, An Inspiring Journey Through a Chronic Illness, Ellen Burstein McFarlane writes about how desperate and vulnerable she was as MS caused progressive weakness, balance problems, and deteriorating judgment. During this terrible time, she read about a well-credentialed vascular surgeon claiming miraculous success in treating neurologic diseases. When she sought him out, he promised her not only remission, but a cure to the tune of $100,000 with $50,000 up front. Of course, it didn't work, and her disease progressed. The warning in her book is, while there are honest and honorable people who offer somewhat effective medical treatments, there are too many charlatans who will prey on your desperation to be cured of MS. Please be careful. In the 30s, scientists learned about the insulation-like material that covers nerves called myelin, like the plastic covering of an electric extension cord. They discovered that by injecting concentrations of myelin into rats, they caused the rat immune systems to attack the eyes, brains, and spinal cords, resulting in what looks just like MS, implying that MS is an autoimmune system condition. There's also scientific support for thinking that a viral infection of some kind triggers this ball rolling in genetically susceptible individuals. Still, with all the work that's been done and is being done to understand MS, as of yet we don't really know the cause and why it's so variable in different individuals. Daily, we are learning more about the immune system, and this has brought a level of some limited success in treating MS. Much more needs to be done, however. There is room for great hope for this mysterious disease. And don't forget, there will always be charlatans who prey on desperate people. Please be careful. Before we end, here are some beautiful words of poetry by the good Dr. Jerome Freeman from his poem On Nursing. The doctor has prodded and nodded and left for the night. Only the nurse is at hand to help engage the darkness. A gentle touch is balm to your fear and pain. There is need for sitting and listening and caring. With darkness and sleep, the nurse will be there. The night watch is secure. The whole poem on nursing is in his book, Easing the Edges, Dakota Poetry and Images. Go to an internet search for more. I sincerely want to thank Jerry and Joe for joining us tonight, talking about how MS can affect lives. Their insights to our questions are truly appreciated. And now on to our flu season update. Okay, people, this is the most boring flu season we've had in decades, and that's wonderful news. Last year at this time, we had 1,700 cases confirmed in South Dakota. This year, 37. Most of us believe this is the result of an effective flu shot. But please don't let these great numbers slow you down. We can only keep the success going if everyone gets their flu shot and practices good flu prevention hygiene. Don't delay to get your flu vaccine. Reduce your chances. Well, that does it for tonight from all of us here at On Call with the Prairie Doc. Until next time, stay healthy out there, people. Hello and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show. Let's get started. Well, 84-year-old man from Sioux Falls said he got back from Sanford Hospital and had many symptoms of MS, but the neurologist told me that my problem is dehydration. I've been told to drink a whole lot more water, but this causes me to suffer from frequent urination. I'm not sure what to do. I feel like I'm stuck between a rock and a hard place. What should I do, Joe?
Well, depends on what kind of an evaluation he had. Did he see his internal medicine? Did he see a neurologist? I don't know what he should do. We should discuss it with his primary doctor.
Yeah, it'd be very, very unusual to have MS at 84. Okay. I would think there's something else going on.
Yeah, and I think dehydration is a we don't know what's going on. It must be dehydration. Here's some IV fluids, and we hope you get better. Call us if it gets worse. And that might be one of those deals. And that's unfortunately what we have to do sometimes. You don't have an answer.
Right.
So monitor, get back to your doctor if it's not getting better and their symptoms progress. 59-year-old woman asks, is there a correlation between MS, psoriasis, and other autoimmune diseases?
Not clearly established.
Don't know.
No.
No, not that you know of. 74-year-old woman from Madison, has there ever been a study done to check MS patients for heavy metal toxins in the body? Could mercury in a vaccine cause the problem?
There's no evidence that vaccines cause MS. Heavy metals can cause nerve injury, but usually it would be peripheral nerve, not central nervous system. So there is no data that I've ever seen that implicates heavy metals in MS.
And there's the minuscule amount of heavy metal, for example, mercury in the vaccine is way less than you would get from eating one fish that's available. It's just minuscule doses. That's just a bunch of hooey. Somebody's trying to sell a book. You agree?
I agree.
40-year-old woman from Aberdeen says she has MS, and my daughter has been diagnosed with an autoimmune disorder affecting her kidneys. Is this something we could have passed on to her genetically? Should I be concerned that my other children might develop an autoimmune disorder as well?
I would think the two are unrelated.
Right, so probably not.
Probably not.
I have a 34-year-old daughter, although you did say, the two of you, Joe, you said that there's a case of a woman with MS and her daughter with MS.
Oh, yeah.
But this is a kidney problem
Right.
in MS.
Separate deal. No correlation that you have ever read.
No.
I have a 34-year-old daughter diagnosed with MS about a year ago, tried the self-injections only briefly and didn't like the side effects, flu-like symptoms, feeling crummy, tiredness, decided to stop the injections and wait until MS gets worse. Is that a good idea, Joe?
No, I would recommend you visit with your physician because there's lots of other treatments. There's options, whether it be another injectable or an oral, but there's something out there that she'll feel better on, you know.
I mean, but sometimes that medicine makes you feel a little flu-like and
Right.
weak, and that's part
But
of
that's just one kind. That's the interferon kind. But there are a lot of other options.
Okay. What's the youngest MS patient you've heard of?
Well, you can have MS in childhood even, 10, 12. I think the youngest MS person we've seen recently was 14.
14.
Yeah.
Years ago, we had an 8-year-old that another physician had, you know.
And do they have a worse kind or not?
I would be worried at that young of age. You'd be worried that it might tend to be worse, but
Okay.
I don't know.
Over
that that's-
time.
Over
There's
time.
just more time to collect problems. 59-year-old man from Yankton said, years ago when my wife was diagnosed with MS, her skin developed a plasticity texture. Is this a symptom?
I would think that's something else again. I mean, it almost sounds like scleroderma, doesn't it?
Yeah.
Which could be an autoimmune type thing too, but it's a separate process from MS.
I would say, though, I have seen people who have had psychiatric problems, and they seem to have a skin texture that's different than people who do not. And I don't think it's related to the drug. I think it's but you don't, that's not something that you're going to talk about. Okay, that's just an observation I don't know any data on. 63-year-old female from Sioux Falls, peripheral artery disease, a friend with a new vein in the leg. 1 year later, it's bad again, then used a vein from the arm and leg is still blocked. What procedures can be done for him? So that's a peripheral artery disease. It's not a neurologic condition. And when you've got peripheral arterial disease, there's many times big time trouble. But we're going to talk about that next week.
Oh.
So we're going to have heart hospital experts explaining about taking care of people with peripheral artery disease.
And they will say that a lot of the people who had fairly untreatable things a decade or two ago now can be helped with various interventions they'll talk about.
Yeah, you bet. That's it. Well, that's it. And they said, oh, right here, my wife made a note. Save this for next week's show. Well, thank you both so
welcome.
much for joining us and sharing us
You're
your
welcome.
expertise. And thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. And until next time, from all of us at On Call with the Prairie Doc, Stay healthy out there, people.
Like other plumbing systems that move liquids, our circulatory system doesn't always work as it should. Vascular disease, stroke, and blood pressure. Next time, On Call with the Prairie Doc.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information.
And by the South Dakota Foundation for Medical Care, an organization working with the state's healthcare community to improve quality of care as part of the Great Plains Quality Innovation Network.
Additional funding is provided by
Aberdeen Asthma and Allergy,
Avera Heart Hospital,
Brookings Health System,
Dakota Allergy and Asthma,
Dakota Care,
Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee,
South Dakota State Medical Association,
Swiftel Communications,
and Vance Thompson Vision.
Closed caption for On Call with the Prairie Doc is provided by
Avera,
Brookings Health System,
and Fishback Financial Corporation.